All
right. Good morning, everybody. Can you smile and wave so I know you're happy? Excellent. Thank you. It makes me feel warm and ready to go. Okay. Great. Let us start with roll call, and then we have a bunch of paperwork we have to get approved. So bear with me if you will. I'm going to go with roll. Kelly Abbott.
Here.
Thanks, Kelly, and good morning. Norma. Michelle.
I'm here.
Hi, Michelle. Ashley Chase. Anna Cole.
I'm here.
Thank you. Jenna.
Hi there.
Hi, Jenna. Brian, I think I saw Brian. No, I did not see Brian yet. Okay, Dennis.
Here.
Good morning. Janelle. Dave Hayes. I don't see. Chelsea. Kevin.
Here.
Hello, Kevin.
Good morning.
Dave Lee.
Good morning, I'm here.
Hello. Renee.
Good morning.
Hi. Beth.
Good morning.
Morning, Brandon.
I'm here.
Hello, sir.
Hey.
Becky is not going to be here today. Elizabeth said she'll be here in a moment, and I see her on screen. Lynette.
I'm here.
Hi, Lynette. Timothy. No. Okay. And Jana. All right. No, Jana. Are there any task force members present that you did not hear your name called? Okay. I think we're good. All right.
I believe I saw Chelsea and Sergeant Cotter join kind of as you were doing. So we'll make sure it goes in the nets. Yep.
Great. Okay. Perfect. All right. I am moving to an abundance of meeting minutes and meeting recap. So if you'll bear with me. The first document that you have had, all of you should have received these documents in the email. They were available to you in the Google Drive through the link. So focusing first on the meeting minutes from April 10th of 2024. And we've got 3 sets. So let's go with the full group meeting. Are there any sort of corrections that need to be made to the full group meeting minutes? I see head shakes no. Okay. No additions. Great. If I could have a motion and a second to approve the full group meeting minutes, and please state your name as you make your motion.
Beth, I'll motion to approve.
Thank you, Beth.
I will second it.
Thank you, Lynette. Okay. Is there anybody who objects to the approval of the full group meeting minutes from April 10th of 24? Seeing none, we're moving on. The intervention subcommittee members, this one relates to you. Same question. Are there any additions to those meeting minutes, corrections that need to be made? Okay. Oops, Chelsea, did you have something?
Oh, no, sorry.
Okay, all right. I see no hands, Trace. So if I could have a motion and a second to approve the intervention subcommittee meeting minutes.
This is Dennis. I'll move to approve the intervention subcommittee minutes.
Thank you.
Beth, I can second.
Thank you. Any objections to the approval of those intervention subcommittee meeting minutes? All right, seeing none, those will pass. Doing the same thing now for our prevention subcommittee friends. Any additions, corrections that you would like to see made to those meeting minutes? Okay, having seen none, if I could again have a motion and a second to approve.
This is Jenna. I can approve.
Thanks, Jenna. A second, please. Do we have nobody else from the prevention?
Second. I can second.
Thank you, Brandon. Got it. Okay. Is anybody opposed to the approval of the prevention subcommittee meeting minutes? Okay, those will pass and be approved as well. Moving to the meeting recap. There were two meeting recaps that were submitted to you in your materials. One again for the intervention subcommittee, one for the prevention subcommittee. I'm going to take those in two pieces because different people attended those meetings, but they are in a single document. So looking at the intervention subcommittee portion of your recap, are there any members who have anything you would like to correct or add to that meeting recap? Intervention subcommittee members. Okay, I see none. If again, we could have a motion and a second to approve that meeting recap from our intervention group.
This is Dennis. I'll move to approve the recap.
Thank you.
Second.
Thank you, Kevin. All right, any objection to the passage of those meeting recap for intervention committee? I see none, so those will be approved. Last, the same thing with the prevention subcommittee recap. Anything that needs to be changed to that summary? Okay, I see nothing. Again, if we could have a member from the prevention subcommittee both make a motion and a second to approve that document.
I'll make a motion to approve that.
Thanks, Dave.
A second.
Thank you, Renee. All right, any objection to the approval of that prevention subcommittee meeting recap? All right, I see none. We are approved and ready to go, Trace.
Awesome. Thanks, Stephanie. Good morning, all, and also a special hello to all of our guests that are joining today. Appreciate y'all being here and being patient as we get some of our logistics out of the way. We've got one more logistic, and then we're going to break into groups, and I'm going to explain that here in a little bit, and you'll kind of go to your group that you're going to be speaking on the panel for. So, but quickly for my task force folks, I just want to remind us kind of where we are on our roadmap. As a reminder, we are staying in our subcommittees today around temporary placements and restraints. Typically, we'd be moving into the full group conversation, but we just weren't quite ready for that. So we are continuing the conversations. And so just appreciate folks and really excited that both groups today have panels where we actually get to kind of sit and listen for a while around folks' experiences more out in the field and different professional expertise. We got a lot of expertise on the call today. Obviously including task force members, but a lot of guests. And so really excited to bring those voices into the conversations today. And then we'll, the June 12th meeting, we'll come back full group with some drafted language around any sort of recommendations that might be coming out of these conversations. And then we'll be back on track, back into the subcommittees in July. And that's that added meeting. So I just want to remind folks that that was the reschedule from July 3rd. We figured the folks didn't want to be here on July 3rd. So if you didn't receive that reschedule, just let me know and we'll make sure you get it. But we'll be back into our subcommittees then: education on trauma-informed recovery for intervention, and education on risks of running for prevention. And then similar back in August, and then September, we will begin to wrap and finalizing reports. So obviously lots of work to do in between these meetings via email, surveys, etc. But this is kind of where we'll land as a full group. So with that said, I want to get us into our groups today as quickly as possible. So we're actually going to typically prevention stays and intervention goes. Today, we're going to flip the script. Doris is very excited. So folks that are with me in prevention talking about restraints, we're actually going to click into the Zoom link provided, and we're going to head into another group. And for folks joining, the reason we do this is because we have some challenges recording our breakout groups. And so because these are public meetings, we want to ensure we can record. So you're actually going to leave this full Zoom meeting and head to an entirely different meeting, which is kind of a pain, but it works. So those are for my prevention folks in the continued restraint conversation. I also just want to name our panelists that will be going into that group are Marnie, Brandon, Pam, Lauren, and then Dennis. Y'all will be joining us in prevention. So again, that's the link that's going to be provided here in a second in the chat. Everybody else will be staying with Doris here around the conversation with temporary placement. And then we will come back at 10:45 Mountain Time. Obviously our guests, y'all don't need to hang on that long. We'll I know we have you for much less time, but for task force folks, you'll come back at 10:45. We'll do our public comment and kind of wrap up closing details. So, Jordan, anything to add? I saw you kind of buzzing over there. I want to make sure I'm not missing something.
Nope, you're not missing anything. I've put the Zoom link in the chat for those who are going to hop over. And I'll see you all over there.
Okay, great. All right, so if you're a panelist I just named, and then my group around prevention, jump into that link, and I'll see you all in just a bit. And Brian, you're host, right? So we're not about to end this call. Okay, cool.
Awesome. Good morning. I think we have all the folks that are going to be joining us today. I'm doing a quick scan to make sure all of our folks that are on the panel, Michelle, Beth, and Lynette, are over here. Thank you so much for agreeing to help to better understand what's happening currently in Colorado with respect to temporary placements. And we'll invite each of you to provide a little bit of insight into how you have stood up and or managed what we're sort of calling temporary placements. It may be emergency placements in your respective counties, just to get a sense of what you're doing today, so that we can then talk about what elements to potentially incorporate into a recommendation and what things that we want to make sure we highlight to exclude. So thank you again for agreeing to participate in the panel today. I'm going to invite each of you to just remind us of who you are, the organization you represent, and then we'll do a round robin of having you just talk a little bit about how you've operationalized the use of temporary placements, so that we can then engage in some conversation. And I have some questions, but we'll invite the rest of the committee members to ask questions, and then I'll try to pepper in any questions to make sure that we're rounding out the conversation. Quick check-in, how does that sound? Sound like a plan? All right, so we'll start with you, Lynette, then we'll move on to Michelle and then Beth. If you could just introduce yourself really quickly, and then we'll come back to have you provide some insight into how you've operationalized the use of temporary placements.
You bet. My name's Lynette Obermeyer. I am currently the Child Welfare and Adult Protection Director in Delta County. I was formerly with Mesa County, where I worked for 17 years and 8 at the state. So a lot of experience, most of it with adolescents.
Awesome. Thank you, Lynette. Michelle?
Good morning. I'm Michelle Bradley. I am the ongoing adolescent supervisor here in Douglas County. So I supervise a team of caseworkers who primarily work with adolescents where their behaviors are the concern and not the parents.
Awesome. Thank you, Michelle. And then Beth.
Yeah, I'm a program manager with Denver Public Safety Youth Programs. I oversee the Ronnie Project, which is the Runaway Outreach Notification and Intervention project. And then I'm also the coordinator for the Denver Anti-Trafficking Alliance multidisciplinary team.
Awesome. Thank you, Beth. So we'll start with you, Lynette, and just sort of like giving us a little bit of context and overview of how you have operationalized the use of temporary placements.
I think the reality is there are no temporary placements. So it is always on an emergency basis or at a crisis level at the time that it is occurring. Youth aren't nice enough to tell us ahead of time when they're going to run or abscond from placement. I don't know why. Just intervene if they did. But the reality is finding a placement that can take them. We'll even agree to take them for 24 hours or 48 hours. We're often just narrowing it down to that long to buy us a couple of days to look for something better. It's also quite frequently that we have to stop and sit with them as a department and find the funds to pay the overtime or the extra money for caseworkers to sit with these children. The dilemma is just not good for kids. Our caseworkers are not trained to be caregivers for these youth. They don't have the same skills that staff at a residential program have. We are not QMAP certified, so technically we cannot give them their medication. That puts us also at a huge liability. And we've even tried to find nurses that with an order from a doctor would come in and do it, but because it's not in a licensed facility, they won't. So then we have kids that go off of their medications, which make things even worse. So the reality is people violate laws. They give the kids their meds anyway. They're trying to keep them contained as much as possible. Depending on the layout and the structure of the department, it may be a safe place for them to be. It may be a place like in Mesa County where they have stairs and a railing and kids try to jump over. It's just not designed to be a place to house children. Motel rooms typically do not like to take our children and let us use their motel rooms for these things. When we have in the past, we have had to ask them to remove the lamps and anything that is breakable out of the rooms, just to make sure that it's a safer environment and that we're not paying all of the damages that a youth may do to that facility. Because again, it's not a natural environment. These kids know this is the best they could come up with. We have worked really well with our local RAE, which is Rocky Mountain Health Plans. They have helped fund some of the extra costs for babysitting youth. They have offered to pay extra for facilities to keep a child a little longer or do different things to try to meet those needs. Back in the day, we used to have shelter placements. And that was a placement where it's specifically for adolescents, where an adolescent could go 12 and up, and stay for 30 to 60 days until you found the right level of placement and the best placement for them. That was eliminated by the feds. They didn't like shelter placements, but it did serve a purpose. And something similar to that might be needed to be able to, not used as widely as before, but might be needed to be able to serve these kids in a more structured setting with staff that are trained in daily programming and some routine and structure, which these kids really strive on.
Do you have any go-to providers? That like it for, and it could be like for certain youth who have absconded or run away. It could be by age or whatever. Do you have any go-to providers that tend to come through in a pinch?
There are a couple, and I'll even be honest, and it may not, we have utilized some resources from our homeless shelter in Mesa County to assist us, even temporarily or for the night. We have a very good working relationship with 2 CPAs that we can call and we can say, we need 48 hours. What can you get for us? And they will do everything in their power to help us find 48 hours. We can get them to provide us with like mentoring hours for somebody to come up and assist with spending time with the youth, or even take them out into the community and do a little something with them to break up the monotony of sitting in the office. But the residential programs, very rare.
Okay. Thank you, Lynette.
Yeah. Any other questions?
Yeah, I have a bunch of questions. We'll do a whole like question for all the three of you after we go through and hear from Michelle and then Beth.
Okay, thank you.
Thank you. Michelle, how would
Thank
you
you.
describe the way in which you intervene to provide some kind of a temporary placement for youth who run away?
It's a challenge. it's very much in Douglas County. We all rally around that worker. We understand that that's a very stressful place for that worker to be in, of like, I have a teenager in my office. Where are they gonna go, right? Like, that's really stressful. We try really hard to use kin and kin like a lot. We try really hard to, our term is safe enough, right? Like, I don't need treatment right now. I need safe enough for the next 24 to 48 hours to find a placement. So if we're looking at grandma, we're looking at neighbors, we're looking at schools, right? Like, is there a counselor? Is there a coach? Like, and then calling those people to be like, I just need like 24 hours. I'll pick the kid up at 8 a.m. tomorrow, right? Like, we just got to figure this out. We also have what we call the FRP, the Family Resource Pavilion, and we share it with Arapahoe County. It's through Shiloh, and they offer respite beds. They're a great program. They do require a lot of documentation to put a kid there. So at 2 a.m, I'm not going to have shot records, right? I'm not going to have 14 days of medication, all the stuff that, understandably they are required to have. So again, sometimes it's begging and pleading. I will be there at 8 a.m. to pick up the kid, to get the meds, to get all the things that you need. So we do use the FRP. They can stay there, I think it's 14 to 21 days, and then there has to be a discharge plan. The other things that we've done is, we have the list of after emergency, like foster homes. Those are great. We have a very small number who will take teenagers. So again, it's a lot of us, like, just for tonight, kind of situation. We have paid for parents to stay in hotels with their kids. Luckily, we in Douglas County, I know our partnering, our communities, counties have had to stay in hotels with these kids. We have not had to do that yet. We've had, we've heard of other counties having to sleep at the office with kids. Luckily, we haven't had to do that yet. So we'll pay for a hotel for a parent to stay with a kid. Back when COVID was like really big, we did have a COVID shelter for runaways who could go there. So when Lynette brought up the shelters, I remember, gosh, when I first started here, was it Jefferson Hills that had a shelter section? That we would
No,
use
it was Shiloh and Savio that did it.
Oh, okay, thank you. We've also had kids that, ended up in the hospital on a run, didn't meet criteria, and we're like, we have nowhere to put them. We are not going to pick them up. So we have flat out refused to pick up a kid from a hospital. Because it's just not safe. If like those other options haven't panned out, we have nowhere safe to put this kid.
Yeah.
So that's become a battle sometimes with some hospitals. Luckily, that doesn't happen often. Yeah, those are kind of the notes I had.
Awesome. Thank you, Michelle. Beth?
Yeah, so our group's a little bit different in the sense of, like, we're working with youth, and so we obviously advocate and work with caseworkers to help ensure that there's a safe location. But like everything that Michelle and Lynette had mentioned, we face similarly. I know in Denver there's a not an official but an agreement with Urban Peak, where they will take youth who run from out of home placement as a temporary location. They at least do have, right, where they're going to secure the medication, like Lynette's point, where they're administering that, and they have someone that's trained to do so. But ultimately, I know their newest location, they'll have more beds for youth. But right now, if a youth goes there and they're over capacity, they're never going to turn a youth away, but they will, it's a potential that an adult will then lose their bed at Urban Peak. And again, so similarly, they have a restriction for 21 days. We've partnered with Urban Peak for our team in making referrals. But ultimately, if we're working directly with the youth, and this is not an out-of-home placement situation, we really work with the parents to try and obtain their consent to allow the youth to stay there. So they could stay at Urban Peak for 21 days. And then again, unofficially, they have kind of a partnership with other shelters within the community. So the Source in Boulder, where it'd be 21 days at Urban Peak, and then 21 days at the Source if needed. And then the most recent one that's come about that's located in Thornton. I'm meeting with them tomorrow. It's the Community Reach Center, the Empowerment Center for Adolescents. Without having met them and just reading over their criteria, they will not accept youth from out of home placement. I do know our DHS caseworkers here in Denver, similar thing, that emergency placement, where do we put them overnight? And so their emergency location is kind of this mixed building. It literally houses, DHS is their emergency placement, the MEP unit with DPD, and then and Brian, you tell me if I'm missing anything, but then you've got the Denver Child Advocacy Center where they do forensic interviews. And where I've seen that this location has been harmful as this, like, all right, a youth could potentially be staying there with the caseworker for a night or 2 nights, observing forensic interviews where all of a sudden the youth is being brought in to talk about where they've been, a victim in a crime, and they're like, oh, I've been here before. And then it's prompting when they were removed from their home. And then that being a barrier to talk about what they're there to talk about, right? Because now they're being, thrown back into that that prior incident. Let's see here. And then the emergency foster homes, I think, we've certainly been a part of wraparound meetings and placement. And the thing we're constantly hearing is when these youth are labeled as high risk or frequent runners, like, it's just a complete shutdown of like, nope, we're not willing to take them. And then to Michelle's point of like, yeah, the safe right now. And then the kinship or family friends, we've seen placements where they're being placed with a girlfriend, and there's history of domestic violence there. And then this has been told that this is a temporary placement, but I can tell you, it's now, we're staffing this case monthly, and it's been over 4 months now that there's been no other location. And a part of that too is going back to like the placement with Urban Peak. Oftentimes it's because the youth is saying like, I'm willing to stay there. And I get that there's that balancing act when we have that frequent runner, as so in the case with the girlfriend, it's like, oh, I want to stay there. Or I want to stay with mom, and mom's been identified as unsafe. And so it's kind of like picking your battles, but also then are we potentially causing harm by that placement? So yeah, that's all I've got.
Thank you, Beth. So smattering of ad hoc, right? Like, maybe a couple of providers that you've used before, but it sounds like, really trying to cobble together something that could work for right now, and that looking a whole host of different ways, depending on what you have available at the time, the needs of the kid, and sort of who you can convince, and or sort of how you can, again, just cobble together something to just get by almost, it sounds like. But would love to field questions from any of the other committee members on that are bubbling up for you. And again, of course, I have some questions that I could pepper in. Kevin?
Yeah, I'm curious when the feds shut down the temporary shelters, because my son was in one in Arizona. The running of it was ridiculous for a whole bunch of reasons. He was there and of course ran away from it 20 minutes before I arrived to pick him up. But I just wondered, what was this about the feds shutting them down, or why weren't we allowed to do them anymore in Colorado? Because they had that's 2000. That was the beginning of COVID, is whenever I encountered it.
Different states run do have different programs. In Colorado, we've been in the juvenile delinquency system. Colorado chose to make that all 40 eligible, so it has to follow the child welfare laws. And it was the child welfare that eliminated the use of shelter placement. We strongly encouraged them not to be used. They were overused. We're just going to be honest there. And states like Arizona have different funding for like their juvenile delinquency programs and stuff that doesn't rely on 40 funding. So they were able to continue with some of their shelter programs, some of their residential programs, whereas Colorado was not.
Right. What I remember, because I sat there for 2 days trying to see if my son would return, that the Arizona shelter had 0 programmatics. They had adults there to make meals and allegedly keep kids safe, and kids could come and go. So most of the kids would go out as groups all day, be gone, and then come back sometime at night. And there was just no control whatsoever in that shelter, which just seemed ridiculous to me.
And that was, Kevin, that was actually part of the rationale in the Family First Prevention Services Act to eliminate the use of emergency shelters, is that kids weren't, generally speaking, receiving a lot of programming. So they weren't receiving services and supports. It was really like, I think what we think of like with homeless shelters, like it was just a bed. And so there was concern about the negative impact then on kids to not receive any services or supports beyond just a bed. But I think, like with lots of things, when, government comes in and, says that this thing is problematic, it's sort of like they throw out the baby with the bathwater and just not recognizing that there still needs to be a place that is kind of like that emergency, we don't have anything else option for young people. And so I think, which is why we're having this conversation specifically around youth who run away, is that there are, for many reasons, that they're at higher risk. They're at higher risk for trafficking. There's something that precipitated their running away. Oftentimes they're older youth, and which are already harder to find a longer term placement for them inside the child welfare ecosystem. So I think it exacerbated what we are already seeing as challenges for certain classes of kids, because now this option is not even available. And so, then, systems had to get really creative in trying to figure out how to find placements for kids. And then I think a lesser priority, still important, but a lesser priority in the moment, is trying to ensure that there's continuity of services and med management and things like that. But they can't be on the street. So I think that's what states ran up against with FFPSA passing, and this no longer being an option, in large part to your point, because they weren't receiving services at these placements. It was just a bed. Good question, though. What other questions do folks have from Lynette, Michelle, or Beth? Lori?
Yes, just so you know, we do have licensed homeless youth shelters in the metro area, not so much in the, Mesa County or the rural areas, but we also have what they refer to host homes, foster host homes throughout the state. We have a program by the name of Safe Families that does serve for the rural areas for homeless youth. So we do have services for homeless youth in both the metro and the, rural areas. However, obviously it's never enough, right? And these are for youth that are non-child welfare. So if they are part of the child welfare system, as Douglas County, right, Lynette is identifying, they cannot place into these homeless youth shelters, unfortunately. So those resources are not available to the counties. But so just so everybody is aware, we do have a number of urban peak detention homes, that are licensed homeless youth shelters. clarification.
And we do have
Awesome.
one in the county, but again, we can't place children there. They call us
No.
at midnight, they get a kid in to check to see if they're in our custody, we're supposed to go get them.
Yes, and the places that Lynette was talking about earlier that were referred to, that she was referring to as shelter, were actually referred to as receiving homes. One was run by Lutheran Family when I was a director there, and there was a receiving home. There's been a number of different ones, but Lynette is absolutely right. Those are no longer. Though we do have an up and coming, well, we actually already have respite rules that have been approved. We don't have anybody licensed to be able to offer that service, but we are working on partnering with some of our licensed facilities to have people, have those be available, and those respite services would be available to the counties. So the department is working to try to gather those services and so forth, because we already have it as an approved licensing type. If you refer to the Colorado Revised Statute under 2669, or is it 903 are the definitions. You will see the respite definition, and we have some rules and regulations that we're working on. But again, we don't have providers that are currently offering those services.
Yeah.
Thank you. Real quick on the respite, I'm not familiar with the rules around it. Could that be an option for youth who run away based on the way the rule is written as you understand it?
Absolutely. So it will be an option for the counties to place the runaways and so forth. But yes, that should be, those will be available. And then, like I said, we have the host homes, the foster care host homes that are out there for the rural communities. And then we actually, in the metro areas, have shelters that are specific to homeless youth shelters that are for runaways. So I think Kevin was mentioning, right, where kids can run away. We've unfortunately had, we used to have Family Tree, and that Dennis Despairs, who serves on this team, he used to run Family Tree, but unfortunately they closed. We had Comitas, we had a number of them, but I think I'd have to look. I think we have 4 right now, 3 or 4 within that are currently licensed. So just, I'm Dennis's proxy for today, and Dennis is, so I am the provider performance manager within the Division of Child Welfare. So we oversee all the licensed facilities and foster care homes certified by child placement agencies throughout the state of Colorado.
Thank you. But the homeless shelters would not be available for DHS kids, or would they? Yeah,
No, they're not.
Yep.
Yes,
Thank you.
That's what Lynette was identifying, and
Yeah.
she was absolutely correct. Those resources are not available. And so if they're in the custody of child welfare, then if they run away to a shelter, that shelter has to immediately notify the county department to let them know that, hey, we have your child in placement, because they will sometimes run away to the shelters for the metro area.
Okay.
But again, that's not an option for our western slope or our rural counties. And so that's where the problem exists. But those are where we have the host homes. And we have the Safe Families is really for, again, non-child welfare youth. So it's for parents that are going to prison and don't have family to help take care, or then maybe have medical needs. And so it's a way to stay out of the child welfare system. So if that helps any.
Thank you. Lynette, you had come off mute and then went back on mute. Did you put what you were going to say in the chat about Mesa County?
Yeah, that there is a homeless youth shelter in Mesa County. Youth do run there and then use false names, but we're pretty good at catching them. Just wanted to make sure that was clear, because the youth here do run there.
Thank you.
From Garfield County down to Mesa County.
Thank you for that. Norma and then Beth.
what's kind of sad is that the youth like it there and want to stay there.
Yeah.
Don't let them. And that's a shame.
Do they have programming? Or is it just a place to stay?
No, they have some programming. They encourage school attendance. They'll transport to services. It is not just a place to stay where they can do whatever they want. And I may be older than everybody else here because I remember when we had agencies that ran a shelter program specifically for adolescents. It wasn't a receiving home. They would take up to 6 youth for the Western Slope. And it was a temporary placement until the right level of placement or the right placement could be located. And it had programming as well.
Thank you, Lynette. Norma and then Beth.
So I just had a question for any of you. Lynette, it's two-pronged. So one is the shelters that you guys are talking about that you do have access to, do you find that to be sort of an appropriate setting for children? Like, do you think it's helpful, or I get that they're needed, so I understand that part because there's no place for kids to go. What I'm trying to figure out is what you have available. Is it something that you find helpful that kids can actually, benefit from? Or, because I guess I feel like this is an opportunity for us to, as a system, to create something different, right? To put something different forward. And, what I do know from experience is that, the shelters that don't have programming for kids, that where we're not using the time that we have with those children wisely, those really don't work. And that is part of, Doris, you mentioned this, that's part of Families First, right? That is what Families saying is, let's not do that. And I really agree with that. And so I'm not saying I'm right, I'm just saying that's my take on it. And so I just want to know the things that you do have available in terms of shelters. Do you think they're beneficial for children? And if not, if yes, what's beneficial? If not, what's not beneficial? Does that make sense?
Yeah.
I know that the shelter here on the Western Slope, we work with them a lot. When youth run there and they notify us if they do not believe they're going to be able to get that child or youth home within the assigned time frame, they call in a referral. We open it as a PA4. We go out and we work with that family and the shelter, and they help facilitate some of the meetings. They get the kids hooked up into services. They'll hook up the parents with services, even family therapy, different things, to really work on the underlying issue of why the kid doesn't want to go home or why the parent doesn't want them there, to come up with a plan without penetrating the whole system, to be able to go live somewhere safely with a legal caregiver. And sometimes we'll open up ongoing cases. Sometimes our homeless shelter, because they do good fundraising, they will continue to provide those services that youth and family need. But those kids are not in our custody. So that's preventing some of those kids from coming into our custody, which I think is absolutely critical. But we can't utilize that service even short term when the kids are already in our custody.
So do we have an idea of what the outcomes look like for those kids in terms of, like, do those providers have to show any level of outcome in terms of, how many of those kids do penetrate the system later? Do they not? Are they, do they go to a higher level of care? Do they stay where they were when they entered that facility? Like, do you know what I mean? Do we have an idea of any of those?
I don't know what their data is. I know that in the 21st Judicial District for 4 years, we tracked all crossover youth, all their outcomes for 4 solid years. And that showed, and not all of them were in DHS custody, so every kid that got a charge. That system, that data showed that there was a reduction in recidivism. There was a reduction in coming all the way into custody and ending up in like QRTP placements, and that the level of care, being that high level of care, was short.
So would it be fair to then say, and Beth, you look like you want to say something, so I'm so sorry that I just keep on talking.
No, you're good.
Would it be fair to say then that we believe from the data that we have that this sort of setup does work for that population of kids that have not entered the welfare system. But if we had this sort of option for them with that sort of programming, that we might be able to reduce the number of children that then enter the child welfare system. And then we know that a whole slew of other things happens, right, when kids enter the child welfare system. Would that be a fair assumption, do we think?
I think so. I think it prevents a lot of kids from coming into our system. Those kids used to almost always enter into our system to get placement when they were refusing to go home and the parents were refusing to take them. It's a safe place for cool down, immediate intervention, immediate discussions, and immediate safety planning.
Lynette, can I clarify with the when you're talking about like the safety plan, who's doing that safety plan? Are you saying the shelter is doing that, or caseworkers coming into the shelter and there's that partnership?
Caseworkers coming into the shelter, and typically we hold family engagement meetings with them. And so it's a facilitated plan. So it's not a safety plan as in a safety assessment. I guess it's even more intense than a support plan typically is. But it is a really good, effective support plan. So I'm using the wrong words, but.
Yeah, I mean, I know my meetings with Urban Peak, like ultimately, like their goal is reunification with the family. But in regards to the programming, for youth that are staying there, all of their programming is voluntary. And so they do offer services just like Lynette laid out in regards to like the families and bringing together and doing family meetings and planning and all of that. But in regards to like their day-to-day programming, to Kevin's point, that's similar as it was in Arizona, the programming is voluntary. So it's like they're offering, 3 meals a day. Here's your check-in time. Urban Peak has, each youth is assigned chores. But outside of that, there's no mandated like, oh, you're going to check in with this case worker. They have case managers. Everyone has that option if they're willing to have that. Now it being under 18, they're going to mandate a case manager, but ultimately, again, it's still that voluntary piece on the youth engaging with that case manager. And I would say based on our last meeting, I think there needs to be something more, where there's an actual built out plan as opposed to just simply a bed, meals, and some optional things.
Oh, I agree. And I think, and the reality is we can't force a kid to do anything. Whether we have court involvement or not, let's just be honest. We can say, we require you to do this because you're in our custody, and we require our providers to provide this. We still can't make the horse drink the water. But we can sure engage them. I think it's more of an engagement model than anything else. How can you get their buy-in? What kind of carrots can we put in front? If you'll go to these group therapies, and like I often talk to kids, if you'll go to individual therapy for 3 times and you still hate it, we will talk.
Yeah, I'm sorry to interrupt. When I talk about programming though, or when I ask that question, Beth, just to be clear, I don't see, 3 square meals a day and a cot and that being programming, right? Like I'm sort of, and I don't even think of programming as being like groups and this is kind of your structure. I mean, like, what is the individualized program that this specific child needs while they're spending time in a shelter bed or whatever, right? I think I said this last time, which is it's my belief that if we're not using the time where we have that child in front of us constructively, right, we're losing time with that kid for sure. And so engagement is key, right? From the second they walk into that door, we've got to figure out a way to engage that child in this process and hopefully their family on some level. This kid may not go back to their family for whatever reason, that exists for sure. But can we use that time to then figure out what their relationship can look like with their parent with X number of services, and then, what's the best place for them to go to kind of next, right? I just think that when I guess what I'm saying is I hope that we're going to be really cautious about not advocating for just a respite bed or a shelter bed, because we've been doing that for decades, right? That's
Yeah.
not what kids need. What kids need is a place to go where we're going to use the time with them constructively, purposefully, strategically, sort of all of those kinds of things, right? And all of that has to be really individualized. And so, 3 square meals in a cot is not, in my opinion, not helpful. It'll be helpful in the moment for the crisis where the child doesn't have to sleep at the department, but I think we can do better than that, for sure.
Yeah, and when we've talked about this, sort of like what happens once the youth has been located, that's where we started this conversation around having a place for them to go if they're not at a place where they can return home or to the placement that they ran from, and really using this as an opportunity to, as best I can recall, I know from day to day it gets tricky, but our prior conversations we talked about this temporary location sort of being an opportunity to also be a prevention kind of intervention. So understanding what was it that caused them to run? What other, what happened while they were on the run, so that, if they were trafficked, or if they were in harm, if they committed any crime, like just to get an understanding of what happened during that time that they were on the run, and then also figuring out what are the longer term kinds of steps for them. So doing an assessment, and also just sort of figuring out what is the long-term placement services and supports. And so I just named that because I want to make sure that we're tying this conversation back to some of the other conversations that we've had. And so as we think about to the extent that we want to put forth a recommendation around temporary placements for youth who run away, we can sort of just be reminded of some of the things that we talked about in prior conversations around what we would want that touch point to look like once a youth is found. And if you're not returning the child home or to their prior placement, what does that quote unquote stopgap look like? And what do we want the sort of like the beyond a place to stay in the temporary, but also what does the programming look like? Lori, then Michelle, and then Norma, you still have your hand up. I don't know if you raised it again. It's just still up. Oh, you did raise it again. Okay. You don't have to make a face like that. We invite your conversation. So Lori, Michelle, and then back to Norma.
Yes. So a homeless youth shelter is not somewhere where a kid lays their head and gets 3 meals a day. I really encourage everyone on this team to refer to the rules and regulations, right? Because there are specific programming requirements in accordance with 7.715 for homeless youth shelters and 7.721 for host home family care. And so with those rule sets, right, it's like you need to look at what those provide. They are much needed services. And I misspoke, there are actually 5. Being a manager, I'm not in the licensing on a regular basis, so I added those in the comments for all of you to see. But maybe even Doris inviting them to the table to have discussions about the services they do provide. So then, when you know that these are offered, and again, these cannot take child welfare youth, right? And so I can already tell you what the gap is. Obviously, it's for our county departments, exactly what, Michelle was talking about, and Lynette, starting off with what does the county requiring to, house the youth until they can find the necessary placements, which is very unfortunate. And that is something that the county has been struggling with, all counties. And so I would really, if you look at the homeless youth shelter rules and regulations, it is not a place to place your head and eat 3 meals a day. And we're, and it's it's a safe place to be rather than being on the streets and being human trafficked, sex trafficked, those types of things, which is huge in Colorado, huge. So they do serve a purpose, and their purpose is to reunite them with the family. If they cannot reunite them with the family, that's when they get in contact with our county department partners to, look at, or if they refuse to go home, because they have a certain limit and all that kind of thing. So again, and would encourage you to invite those folks. I know that they would be more than happy to come to the table to have conversations. They do serve a definite purpose in the overall picture of what's happening. It's what we're missing is honestly with the county departments and where kids can go.
Yeah, and that's really, I think, a good reminder, Lori, because our charge is really focused on youth who run away from care. And so, I think having these other, programs available is helpful, generally speaking, for the population of youth who run away. But in thinking about how best to intervene, even temporarily for youth who run from care and are then found, how to ensure that they have not only a place to stay, but also continuity of services, an assessment or what have you. Michelle, and then back to Norma.
Thank you. I was just kind of writing down some thoughts when Norma was asking questions. So I think, the shelters, I think, are great for a certain kind of kid, right? So like, we have a youth in the YIT program who is significantly mentally ill, significant substance use. And so in a YIT case, we don't have custody, we have authority to place. And so that shelter, the place in the Springs, was in great communication with us, was like, he's here today. Can you come down and see him? Like, can you lay eyes on him today? He's here. And so there was really good communication with that. I don't know if it was case manager or the person working the front desk or what, but like they were really working with us around that youth because we had significant concerns. And then, I've had 13-year-olds end up at Urban Peak or the place, and there's, higher concern for trafficking at that point, right? They're so young. And I've had Urban Peak specifically know that we were involved, didn't kick the youth out, and was working with us, kind of like not supposed to, but we're going to help this kid, right? Because we were talking to them around how we were trying to get them home, the services we were getting set up. And so I've had really good collaboration with the shelters. I think to Norma's question around like the programming, I think that's tricky because you don't know how long a kid's going to be there, right? So to sit there and say you're going to have a case manager and you're going to come up with like goals and treatment and all these things for the kid then to be picked up by the caseworker the next day and go out of state for placement, right? That's hard as a, compared to the kid who's going to be there for 3 weeks, right? That looks, so how do you invest all of that resource and energy into a kid that like may leave the next day versus a kid who's going to stay? I don't know, but I do think Norma's right. I think it's needed. I think there needs to be some parameters or structure around that. Yeah, those were my notes. Sorry.
Awesome. Thank you, Michelle. Don't apologize. Norma?
Yeah, so I think I guess I would say two things to Michelle, to what you were just talking about, right? One is I think that when a kid does come in, we have to make sure that we are doing a good assessment on them to figure out, right, is this a child who's going to leave tomorrow, or is this a child that has a possibility of leaving tomorrow, right? Or is this a child that we really can have for 14 days or something and figure something out? I think that the other thing I would say from a clinical perspective, from a treatment provider perspective, is that in a shelter, in my opinion at least, treatment doesn't belong in a shelter bed, right? You don't want to get a child connected to somebody, start working on therapeutic issues when they're going to leave in 14 days. It's just not, in my opinion, not healthy for the child. So there's, sort of a, there's a time and a place for everything, right? Treatment belongs wherever the child is going to be for hopefully a longer period of time. If that's home, great, then we're going to do that there. If it's in residential, then we're going to do it there or whatever. But in a shelter, I'm not sure that treatment belongs there. Assessment for sure. Programming that gives us more information about a child for sure. So for example, if they're in public school, taking them to public school, trying to talk to people there, trying to figure out what that kid looks like in that school setting. If they're not in public school, trying to figure out why, like all of those kinds of things I think are super important in assessment. And then Lori, I just had a question for you because I've always been super, super curious about this. So I've heard before that, kids don't get their medications when they're in detention, and I just don't get that. Like, is that real? Do they really not get their meds while they're in detention?
So I have heard the same thing. I do not oversee detention programs because that is a locked up facility. So that is under the Division of Youth Services. So the best person to ask, I think he's in the other group, but that would be an open question. I have heard that before as well, Nora, not directly from the detention, but from other sources. So interesting, you've heard the same thing. So I don't know, if that's true, but that it would be something to ask our DYS partners.
Okay. I'm sure that this task force doesn't have purview over that whatsoever or whatever, but I just would add that to it to just say, like, that to me doesn't make any sense. If a child is in detention, to have them locked up in detention and not give them their medication and still try to get them out of detention when they're off their meds and they're, going ziggity boom because they're off of their meds, just doesn't make sense to me as a system. Just feels like we're missing an opportunity there as well. So whatever.
Yeah, I had things like that with my son who was in detention a whole bunch of times. And there are times where his medication prescription ran out and they wouldn't get him a new one. And he was just left to go off his medication without any intervention at all. And, I screamed about it and they started quoting laws to me. So I don't know. That was a while ago. So it's traumatic for me. So I'd almost rather not to revisit that ground, but I experienced that a couple of times.
Thank you, Kevin. Lynette, and then we'll go to Beth.
So first of all, Dave Lee is in this group, and he is the Western Region DYS person. So we can definitely field that question off to him. What are the barriers? Because there's probably barriers. I was just thinking, we used to have a program called an ATU, an acute treatment unit. It was a step down from a psychiatric placement, but a hybrid between that type of a unit and programming with a more of a shelter-based unit, and not the level of a psychiatric placement, but that type of programming and service in different regional areas would be really effective. I think as our temporary placement, because you had pretty good programming rules, structure and staffing requirements. It was a decent rate of pay. So you provide the money and the funding literally to make sure that you can meet these kids' needs for safety and well-being and stabilization so you can get them back into their regular programs. My concern is that the need is really high. The most recent survey that CHSBA just did on finding out how many kids are in stopgap measures is averaging 79 kids a month that are either spending time in hospitals, DYC when they need placement, DYS when they need placement, county offices, or motel rooms. That's enough to fill 4 QRTPs.
Do you know how many of those are runaway youth?
No.
Did the survey include that?
It did not, but I do participate in CHSBA. So, and we have our monthly meeting tomorrow, and I will put that on the agenda and find out.
Perfect, thank you.
Can't start drawing over the last couple of months, at least some data.
Yeah, thank you. Beth?
Yeah, I just want to go back to there's a couple comments thrown out surrounding human trafficking. And I guess I want to touch on, you know, my office is building out a really great partnership with Urban Peak. Whether we've identified from the MDT that a youth is high risk, and then we learn that that youth is either staying or regularly goes to Urban Peak. Ultimately, we notify their staff and let them know, hey, someone from my team would like to do outreach, and this is what that partnership and outreach looks like, knowing full well that Urban Peak is not going to say that youth is here. And then similar, you know, we've started getting referrals from them, but ultimately, again, it's only if the youth is wanting to receive services, but at least we're starting to build that out, so that Urban Peak has a direct contact to getting services regarding high risk youth for human trafficking.
Thank you, Beth. Lori, you put a comment in the chat about the service that a PRTF provides per definition. Is that the acute unit service that Lynette was talking about? I just want to make sure that I'm tracking what that is in response to. Okay.
Right. That's yes. Because a PRTF is technically a stabilization unit, and it's a step down from a hospital or a psychiatric hospital. However, right, PRTFs are, you know, we've had a few of them. They have not been accessed the way they should be. And that is something that we are working with our PRTF partners. And we had a number of them come up that became licensed as PRTF as the result of the implementation of Family First. So that is something, right, that the department is currently working on, but that is exactly what Lynette is. If you're looking at the continuum, that is where they are defined as per the Medicaid laws as a stabilization unit for psychiatric care.
Thank you, Lori. What other questions do you all have for our panel members around implementation of sort of ad hoc, as needed, temporary placements for youth who run away from care? Kevin?
Well, the other thing that comes to mind is, I mean, kind of what do you do about security for youth? Because it sounds like it's a really ad hoc system right now. What do you do about security whenever you know you have youth that are prone to run away? Because, again, just going back to the Arizona experience, the staff there just kind of shrugged and said, oh yeah, they run constantly. Half our kids run. There's nothing we can do. You know, we're not allowed to touch them. We're not counselors. We're just kind of here to manage the place. So.
We do a lot of safety planning, supervision planning. I've had families, you know, if we're placing with a grandma for the weekend, it's like I will send her like a day from like a calendar, like every hour, who's supervising the kid, right? Because you have to go to the bathroom, you have to sleep, right? Like, you know, we have kids sleep in the same room as a caregiver, alarms. It's not totally different than what, you know, I think foster homes, you know, implement. And then I think it's a lot of check-ins with the caseworker, you know, making sure the kid went to school that day, checking in with them at school, things like that.
With just ad hoc, you do what you can with.
Yep.
Yeah. Okay.
We also love to stalk their social media because they will put everything on their social media. And so, right, so then we're like, okay, they're at this park, so I'm going to go to this park, right? So we do that too.
Thank you, Michelle. Thank you for the question, Kevin. Other questions?
I'm just curious what other people's ideas for what this temporary placement. We have a magic wand right now. We can paint our picture. It's up to the legislature to make it come true. What do you want it to look like?
Yeah, I was getting ready to go there next, Lynette. So thank you for helping us to transition. I mean, I think, you know, so I know Norma mentioned, you know, really having an opportunity to do a comprehensive assessment. You know, several of you have mentioned, you know, as part of existing programming in some places or prior programming, that continuity of services, medication management, ensuring that they're continuing to be involved in like their daily activities, like going to school and helping to coordinate that. But what are some of the other things that you think would be necessary components of that temporary placement option?
I think one thing that we struggle with, when we're trying to find a placement in general, is there's so many disqualifiers, such as IQ, charges, number of runs. And so like, I get that, like, if we're looking for like ongoing treatment, the disqualifiers, I get that, but I think there needs to be maybe a difference in those disqualifiers when we're looking at like a temporary, safe enough place.
Okay, so let's name those things, like things that should not be disqualifiers for these temporary placement options. What are those things? So you mentioned IQ, if they have any, say that again?
Charges.
Okay. I would classify that as maybe criminogenic behaviors, prior criminogenic behaviors.
Right. The history of running.
Right, because we're talking about kids who run away. What else? What are some of the frustrating disqualifiers that you've run into in trying to find a placement for these youth?
Lack of progress in prior treatment. And they see running away as a lack of progress. Any aggression.
Thank you, Lynette. Others?
They don't like them when they misbehave, Doris. The problem is we don't place the kids that don't misbehave. They don't need that level of treatment.
Yeah. And is there really such a thing as a youth who doesn't misbehave? That's part of their development.
Not unless you just look at TV.
Any others?
Lack of placements.
Say more about that, Lynette. So we're looking at the disqualifiers.
Well, because of the lack of placements, it's a supply-demand issue. We have a lot of supply. There's a lot of demand. There is not very much supply. So programs can fill their beds with the kids with the least problematic behavior. So those are the ones they're going to pick over the tougher kids or the kids that run away.
So could there be like a no reject, no eject?
We tried that once with a contract and prepaid beds with the facility. Mesa County did, and they absolutely refused to do a no reject and no eject. Because they're private organizations.
Yeah. Thank you for that. Norma?
I mean, I think as a provider, I would say, I think we need to be really cautious about those kinds of things. I think because, providers know what their milieus look like, right? And if you are forced to take a child in that doesn't fit that milieu, and the milieus change, right? They sort of, you get a number of young kids in, and then you get a bunch of old kids, right? Like, so they change. And so I think that, again, for me, those kinds of things are, how can I say this? I think they're like, they put us in a position of like when we are, we're desperate for something. And so therefore we say, like, you have to take our kids. That's all there is to it. Instead of it being something that is, thoughtful and purposeful. And I get that when a child runs, we don't have time to necessarily be thoughtful and purposeful. But if we had a number of places available where kids could go, right? And those places have those places sort of specialized in certain things, then that, to me, that's then we can be thoughtful about where we put a child, right? In a moment of crisis, we can be thoughtful about where we put a child. Where if we just are like, you know, we have 3 providers and those providers have to take our kids, then, you know, we're not really doing a whole lot different than what we in the past, if that makes sense, in my opinion.
Thank you, Norma. So I want to come back to the assessment piece that we've talked about in multiple conversations. So recognizing that you know, a youth is located and in the instance where you don't have a long-term placement yet located, or just don't want to put a kid back in their prior placement or back with a foster family or what have you, you want to have an opportunity to have some expertise engage with that youth to find out, you know, what happened during their run, and make sure that, you know, any additional needed supports and services might need to be wrapped around them are identified. What are some of the things that you'd want to make sure are called out in the assessment piece for those providers that are providing temporary placement?
I think it would be helpful to share any assessments that we already have, right? Because our kids are assessed all the time.
Constantly.
Right? And I don't want to put a kid through another assessment. So if we have a psych eval, if we have, you know, something else to provide, and then they can determine, okay, like, do we need this, or can we work off of this? Or, you know what I'm saying? Like, maybe like that would be helpful.
So review of any prior assessments that were conducted on the child or youth previously. Brian?
I think so.
I think that makes sense.
Yeah, just as a reminder that this group has taken on so many important topics, and in the past we created recommendations already regarding post-run risk assessments. And like you had mentioned this
I forgot that.
already. No, you had mentioned that previously about how like these things will definitely overlap. And so thinking of ways that the temporary placement is one piece of that you know, post-assess or post-run assessment, just trying to link the different places that this task force has already visited. And then the task for myself and Jordan in particular is going to be in the final report, you know, weaving those all together to make sure that they overlap in a logical way. But yeah, I just wanted to name that these sorts of things like a post-run assessment was something we've already been drafting recommendations and having a longer dialogue about, that this temporary placement conversation fits within.
Appreciate it, Brian. I forgot about that. I imagine somebody else might have, so I was going down another rabbit hole. Okay, so scratch that question around what we might include in the assessment for the temporary placement. What other considerations do you want to make sure that we include in that temporary placement recommendation? So, you know, just re-articulating that, you know, some kind of requirement around assessments, looking at some policies around not, now the word is escaping me, but not basically exempting youth for certain criteria, because we know that these youth that we're talking about often are exempted from a placement because they, you know, have, you know, what we already talked about, prior, you know, history or frequent runners and so forth. What other considerations do you want to name for this temporary placement option?
My first thought is that the focus needs to be on stabilization and recommendations for next steps. Because I agree with the person that said, and I forget who it was, I apologize, it's not the time to have a new therapist come in and try to build a rapport and do long-term work. It's a therapist that is there for crisis intervention and quick short-term stabilization, and turnaround. Because of the way FSPA is set up, it would also be a good idea to, because you have to have a QRTP independent assessment within 30 days of admit to a new program, that could be conducted at the same time. Do they still require that level of treatment? Are there other recommendations? So it can all be housed in one area, is what I'm thinking. If we're just shooting for the moon.
Thank you, Lynette. And I see Lori put in the chat, the implementation of trauma-informed safety plans and de-escalation techniques has proven based on research to prevent runs when implemented correctly. Some of that I think came out in our conversation, but I like the succinctness with which Lori articulated it in the chat. So I want to make sure that we include that. And then this, the formalizing of assessments and assessments about the ecology of the child and the here and now, assessments that are individualized and not standardized. I think there is a need for both. I think that's also a really important point. I want to come to Beth really quick about, you know, I know that in prior conversations with youth who run away, you've named some of this as part of the approach, but I want to come back to you in terms of what are some of the things that you found to be really effective post-run for young people that, you know, might be memorialized in a recommendation.
I think I would just reiterate like the safety planning piece. Like for my team, you know, especially our high risk youth that we work with, like it's not if they're gonna run away, it's I mean they're going to do that. And so really building out who are they gonna outreach to, right? Who are, you know, how are they gonna get basic needs, those kinds of things, and really seeing it come to fruition of like, you know, where they're outreaching to our outreach specialists and we're going out and recovering them. But that's a long-term game. That's not going to happen after meeting the youth, whether it's a caseworker or someone from my team just once. Yeah, the building up the rapport and trust and then building out the safety plan, I think is crucial for this.
I'm interested, Beth, in your comment that that they're going to run, that you know they're going to run. That as a parent who identified early that I had a youth with tremendous problems, my biggest frustration of the system is how reactionary it was. How it was obvious there was going to be more problems, and yet you couldn't get to the level of care you needed to until more bad things already happened. And unfortunately, in my case, those were horrible things, and that put them in the legal system and everything else. So, and I've talked to several, obviously, we had numerous in-home therapists come out, and they all basically said the same thing, that the system is so reactionary that we know that things are going to happen, but you can't get them to that level of care with that knowledge. You just simply, you know, are kind of stuck. So.
Yeah, and I would agree with you. I think a lot of systems, Kevin, are very reactionary, but even with the proactive, once a youth gets on our radar and, you know, we're doing wraparound meetings and bringing in all kinds of service providers, there are just so many systems and barriers in place, like even insurance, or, you know, we've had a youth who it was like they were in custody and we had a placement, but then for substance use treatment, but they lost that placement because they were like, well, she's been, you know, clean and sober, but it was because she was being held in detention. And that's where and in that case, that youth was like, I'm ready for treatment. And so being able to instantly, when you have someone who's like, I need help, I'm wanting therapy, I'm wanting substance use, then it's like great, and we all come together and try and kick it in gear, and then it's like we can't find a placement, or insurance is not going to cover it, or we've had insurance companies where they're like, no, we've already covered that once and we're not going to do it again. And so it's trying to be very creative, but there's a lot of things in place that make it extremely difficult, and ultimately we're failing these youth.
Right. The other thing that I'm interested in you mentioning about, we tried that once and it doesn't work, and I heard that 1,000 times, or we already did this treatment. I mean, a lot of these youth, you have to let them get, grow into the developmental stage where these things can kind of take. My son's finally starting to get it now, but people had given up on him years ago, and that's a big frustration as well in the system as a parent that experienced it.
Yeah, and I think that's certainly, with my team's approach is that, whether they ghost us for a period of time or they're mad at us one day, like we're always going to continue to show up. And similar with providing the services, it's just then we're limited. There's so few substance use treatment locations for youth. And then, right, whether they're policies and procedures, it's like, oh, okay, well, they've already tried that, so we're not going to allow them in. And yeah, to your point, Kevin, like sometimes when they first go through it, they're just not ready, emotionally, mentally, right, like to take on that treatment. And so it's really frustrating when we then have a youth, whether it's 3 months, 3 years from now, of like, okay, I'm ready for that, and then it's like, no, sorry, you already had your opportunity.
And I think some of that comes back to Norma's point around, I think it was either Norma or Lynette, about this sort of like supply and demand imbalance. And then like when you have the ability as a provider, to sort of like decide which youth you take in, I think it does leave this gap for kids who are just harder. And so I'm wondering if there might be an opportunity to outreach to and maybe even in some ways incent providers who are really passionate about this very challenging, hard population, but a population that really does have the capacity for change in a way that older adult populations may not, right? And so I just wonder if there might be an opportunity to design something where there really is an opportunity to potentially get new entrants into the ecosystem amongst providers that really that are just passionate about this challenging population. So that's just a reflection that I had that I'm just sharing out loud. Sergeant Cutter, I know that you, that law enforcement responds to youth who run away. And when you're looking at where to take these youth and sort of thinking about temporary placement options, if there are any thoughts that you have around what could be incorporated into a temporary placement option, just from the perspective of law enforcement.
Well, I think Beth really summarized a lot of it really well. We're definitely in a little bit of a different spot because we have to evaluate. We usually with these runaways, they're related to parents, and we take them back to the parents, and that's like the default answer. So when we do these institutional like escapes, when these kids are running away from placement facilities, we do get pretty frustrated. A lot of times it's the placement facility that calls us and says the kids run away, and then they close out their bed. And so when we try to bring them back, there's not really an option. Then we're trying to engage human services, and sometimes that human services agency is not in Denver, and so we have to try to get a response from another county. So we do get some frustrations with that. So it would be nice that when we think about placement, sort of a topic we haven't really talked about is the availability. Not so much do we have them existing, but do we have the ability to put them in there in this timely fashion? So if we create barriers at 2 a.m, that's going to be another barrier that has to be overcome to get this kid somewhere safely in that moment. And so I'd like for us to kind of contemplate that. It's definitely more out of my realm than maybe a lot of the other professionals we have here, fortunately. But I'd like to make sure we have a system that when our response process, whatever that ends up looking like, law enforcement or otherwise, encounters this kid, that we have an actual place that's open. and ready to enact whatever kind of guidelines that we're throwing out there. So it's more than just, I guess, this kind of pie in the sky of we want a place, but more boots on the ground, like actually have a place. So.
Thank you. Thank you. So I want to come to this question, which is a little bit of a tangent from the temporary placement conversation, but it was triggered when you were speaking, Sergeant Cotter, is around a youth runs from a placement and the placement doesn't hold their bed. Is there any requirement today, and or could there be, around holding the bed in a placement for a period of time while the youth is on runaway status, so that there may be that option if the youth is found within a certain time frame of returning them to the provider from which they ran? Lynette, and then I saw Michelle and Kevin, you both came off mute, so we'll go in that order. So Lynette, Michelle, and then Kevin.
So child welfare is allowed to pay for 7 days to hold bed if the facility is willing to hold the bed for the youth as well. So we may offer to pay, but the facility says, we're done with this kid, we just can't meet their needs, and that may be accurate, then we wouldn't pay to hold the bed, but we can pay for 7 days.
Thank you, Lynette.
Yeah, that's been my view that there was. Oh, sorry.
No, I thought Michelle, but then she muted herself, so I didn't know if she still had anything to add.
I mean, Lynette answered it. Yeah, it's like a 7-day thing, but like in their contracts for placements, like we ask for a 30-day notice. Like, let's say they go back to the placement, right? We ask for a 30-day. Do they always do that? No.
Okay. So they're not supposed to just relinquish the bed the day that the youth runs away?
No.
Okay, thank you. Kevin?
Yeah, that's basically my experience, that they always held the bed for a few days. And for a lot of kids, that might be fine. My kids, sometimes we couldn't find it for 2, 3, 4 weeks. And obviously that wasn't an option. He wasn't coming home. He wasn't contacting his parents. He was running away from all authority. So we'd actually have to go out and find him. And I imagine he would have stayed out 2 or 3 months if we couldn't find him.
Thank you, Kevin. Norma?
I guess I was going to say the same thing, right? Like, providers are held to, you're supposed to give a 30-day notice if you're going to discharge a child. Sometimes kids leave, and the reality is sometimes providers will say, no, we're not taking that child back, and we won't give a 30-day notice. I mean, I'm no longer in the residential business, but still, I mean, I have been. Or we won't hold it for 7 days. And there's lots of reasons why. I mean, sometimes, a kid will run because of whatever reasons, and they may have had a huge fight with one of the kids here, and it's not safe for them to come back to that same facility. There's that's just one example. So I think, again, kind of where I just continue to land is just the need for even if a child runs, right? So when a child would run from our facility, what we would do would be, contact everybody and then try to get everybody to the table to talk about what's going to happen next. When we find this child, what are we going to do? Are they able to come back here? If not, where can they go, right? Those things are so important. And I think that, look, this is a pipe dream, but, I think that the way our system is set up, it doesn't allow for all of those things to happen, right? Caseworkers are super busy and their caseloads are super high. And, if a kid is on the run, they're not in their face and they're not creating problems. And so, unfortunately, they're going to the next. And so, and same thing for GALs and for probation officers. And I'm not blaming anyone by any means, because I think everybody is doing the best they can with what we have. But it feels like there needs to be, just a systemic change on how we look at this issue, and what the protocols are going to be when a child runs. So how do we hold every entity accountable to the minute the child leaves and we know they're on the run and they're not coming back? So, whatever that is, 5 hours into it, 10 hours into it, 24, whatever it is, the number, what is the protocol that has to take place with all entities that are, that are in the life of that child? The residential facility that they ran from, their parents, the GAL, the caseworker, the PO. What's the protocol that we have to have in place systemically that has to happen when a child runs, so that when the child reappears, we're not all running around like chickens with our heads cut off trying to figure out what to do with that kid, but instead we at least have some semblance of an idea, a plan of where do we go from here. How do we help the residential facility, if they're going to take that child back? How do we help that facility prepare to have that child back? What are the things that need to be in place for that, right? Because again, I guess my sort of overall theme has always been, we should be working on this child every minute of the day, whether they're with us or not, right? And so how do we figure that out as a system? I don't really know the answer. Wish I did. But I just think it's just larger than where does a child go?
Yeah. Yeah, we've had some of that conversation around what happens once the child leaves? What does the immediate intervention look like to find the youth? That conversation is also included bringing together this multidisciplinary team to do kind of a joint staffing, because we recognize that different players that have touched that youth have different information. And so what we're really talking about today is that piece where the youth has been located, and they're not going back to the placement or place from which they ran. And we need something that is that temporary place for them to stay, so they're not in offices. They're ideally not being put up in a hotel, but there's a place that has some programming that can do an assessment, and whatever else we name, maintain continuity with services and supports that were already in place. What does that then look like in greater detail? Beth, you had your hand up and then you put it down.
Yeah, I mean, I guess I just want to stay on, with that, along those lines of like, I would require that with these facilities, that they have like a free bed, 2 free beds, kind of similar to DYS, where like they're mandated to have, right? It can't be, because once, these are created, they're gonna fill up quickly based on, obviously, our discussion and Lynette throwing out those numbers, which are absolutely insane. But because we're gonna have those cases where a youth is, wanting to come back. Like we had a case where it's like youth was in California, high risk youth, and wanting to come back, and coming up with barriers of like, well, we can't actually look for placement until the youth is back in DHS custody. And so by having those free, like there's always going to be that bed that can serve as that temporary placement, and we don't have to be running around trying to figure out that in between. So I would mandate that there's got to be free beds at all times.
And for those beds, Beth, what is the overall placement type that you're thinking of, where they basically have some set aside beds?
As in like this intermediate, similar
Yes.
to kind of what we had, and I don't know, I can add it to the chat, but like it was in the notes of like what we had kind of carved out from the last meeting, where it's this, potential up to 21 days, but also it's, kind of those immediate crisis worker people. Because I realize like you can't have as everyone discussed, of like someone that's going to full on take this like as the new therapist, but those bridge to the gap service providers that are skilled in therapy, substance use, that kind of programming. That's what I envision.
Thank you. Do we have data on the average length of run for youth in Colorado for those who are in care? Has anybody seen that?
I don't think so. I think there's some barriers to how that data is collected. I mean, they're entered as a runaway in the trails after you close the placement. So those first 7 days, maybe or maybe not. And if the youth is in the juvenile delinquency system specifically, or even DNNs, if they're gone over 30 to 45 days, the court may terminate their custody, hoping that they'll come back, but they may close their case or close their custody, and then the removal is closed, and we're no longer tracking how long they've been missing.
Okay. So I did, and maybe this is a note for Brian. I think that it would be worth putting in the recommendation that there be some kind of mechanism to consistently capture that average length on runaway status. Because it, I mean, if this group is, one of the things that we've talked about is like, how long should that temporary placement, what is the right time? But we've also talked about, we just talked a little bit about keeping the beds open, so maintaining the prior placement availability for a youth who runs away for some amount of time, that there are already policies around that. But it seems like the policy may be arbitrary if we don't have any data on how long kids are in runaway status on average. So that might be useful data to sort of require capturing, just so that, we're designing and amending programming to support the needs of youth in the data. Kevin?
No.
Oh, you just were still unmuted. Sorry. Are there other supports that we haven't, services or supports that we haven't already talked about that you'd want to make sure that we name as part of the programming for these temporary placements? Maybe thinking about some of the things that when, in the olden days, where you were able to access a wider array of options, were there pieces that really work that we haven't talked about already, including in these temporary placements? Kevin, did you want to say something different, Kevin?
Yeah, the thought that comes to mind is that you'd think this temporary placement would want to be at a facility that had extra capacity, and there used to be a lot in Colorado. They were all kind of shut down a couple of years back, but it just seems like you'd want to use part of an existing facility that had all, they had the doctor on staff, the psychiatrist, etc., for that small number of youth, and house them there. And hopefully you'd want to default towards more security, not less, because most of these kids probably wouldn't be runaways, but a percentage of them would, and they're not assessed yet because, they're just being returned. So that's where that was a big problem with the Arizona facility. It was a standalone place. It was built specifically for this person, but they never housed it with the kind of staff that they would need to do any interventions. And it had to be more expensive to do that way.
Thank you, Kevin. Are there staffing considerations that this group might want to include in a recommendation? And again, I'm thinking about some of the examples that used to be available. Lynette, I see you came off mute.
I was just going to say, I think it's not just a number of staff, it's the ability for facilities to pay a decent enough rate to be able to keep and recruit good staff. You can't keep paying people with bachelor's degrees $12 an hour. I wouldn't do it. Sorry. I'd go work at McDonald's for 15. So it's a twofold problem there. I think if we pay the right amount of money, facilities could keep the staff. They could become better qualified, better quality staff for these youth, and our youth would benefit from it. I don't think anybody who's in this business cannot do the best job for kids.
Fair.
And I put in the chat that I think a lack of really good, solid permanency planning is also one of the issues from the child welfare side and the JV side. Some of these youth, in my opinion, and what they've told me anecdotally, is they run because they don't know where they're going to end up. They just think they're going to squirrel in this system until they eventually age out. And that's not fair to them. And if they are going to age out, let's be honest and let's get ready and let's remove the barrier that they can't be in an independent living program before they're 18. Because
So definitely, I'm sorry, Lynette, cut you off.
that's a really good outcome for some of these and something for them to say, I'm working towards this.
Yeah, I think the and you put this in the chat and shared it out loud as well, Lynette, this piece on permanency planning. And the, you know, sort of, so I think there's a balancing of like what can reasonably be done in a temporary placement, recognizing that the whole point of it is that it's temporary, but also wanting to maintain some level of continuity that continues to use every touch point, every opportunity, to Norma's point, to further enhance the intervention for the youth. And so having a priority around permanency planning and what that could look like in a temporary placement setting, I think is an important consideration. Norma, I think you either had your hand up or you're off mute or something. I'm making that up. Okay.
I did have it up, but then I took it down. Sorry.
Okay. So I'm not crazy. I mean, I might still be crazy, but not in this instance. Okay, and I see your comment in the chat, Norma, around the rates. And if there were, 2 beds, if we're talking about 2 beds, that it doesn't seem like it would necessarily change the staffing requirements for a facility. So it could be possible to incorporate that requirement without any substantial changes to expectations or rates. Did I read that right? Okay.
Yeah. I mean, it shouldn't, I think the other thing is, to your point, Beth and Lynette, just around like, well, I think it was you, Lynette, around staffing and being able to hire people, right? That, we're going to pay them well enough to make it worth their while to get cursed out by a child 24/7, right? Kind of all of the things that happen that are hard, right? It's hard to deal with that stuff personally. But one of the things that we're doing with this sort of this pilot with Shiloh, and that we're going to continue to try to work on, and an idea that we had that I'd love to be able to share with some other providers, with some residential providers, is the thought about having instead of doing the way that we've always done shifts for staff, where we, it's like an 8-hour shift, right, or 4 10s or whatever, that instead maybe we do something, if we could get folks to get paid enough, right, that we could, and when I say that, I mean like that we could get providers to get paid enough, that could we do some kind of scheduling with our staff where there's the opportunity to take one child and go off campus with that one child within your shift. So, we talk about respite for parents, right, whose kids are making them crazy at home. And in order to prevent some kind of significant issue from happening, a parent can access respite. I sort of look at childcare providers in the same way, right? They need an opportunity to get away from these kids sometimes too. They need the opportunity to have some variation in their day with children, and so is there a way that within an 8-hour shift you could have 2 hours where you're assigned to Joey, and you and Joey are going off and doing something still, program oriented, treatment oriented, right? It's still supervised, it's still part of a plan, but could we have an opportunity where we're helping providers be able to offer those kinds of things so that their staff aren't in front of these 16 kids 8 hours a day for 5 full days, right? It's a lot. And so, is there a way to do that? I don't really know. I mean, we're sort of trying it on a very small level. But there's lots of things that bachelor level people can be doing with children. And can we help provider staff this a little bit differently than we have done, in the past? Way off point I get that, Doris, so sorry.
No, but I did have a thought around, you know, sort of like trying to connect that to temporary placements. You know, I think that there might need to be the, you know, particularly if we're looking at existing placement options, sort of like having a carve out of their programming that's specifically for youth who run away, that is kind of like that temporary placement option. There might need to be, for that part of the program, some different staffing levels, including the ability to allow for folks to your point, sort of break away and have like that one-on-one time with the youth, versus, you know, just having, I think, particularly if we're talking about runaway youth who, for lots of reasons, are more complex and complicated kinds of, as a population. There, I think, sort of thinking about, you know, what those considerations might be for a staffing perspective for a program that's focused on temporary placement as part of like a bigger provider array of program. I don't know if I didn't say that eloquently, but where it's like just a piece of their overall operation, that staffing consideration for what the staffing might look like and what the specific needs of the staff might be for those who are working directly with youth who have run away. And I think particularly for youth who have a history of running away might be a consideration. And then I had another thought that escaped me. Any other thoughts, questions, reflections as we think about programming, infrastructure, staffing, other requirements that might be needed in order to stand up or expand the availability of options, of temporary placement options for youth who have run away and subsequently been located? Sergeant Cotter?
So I just because, you know, we're doing this, we're recording it, I feel like we should just address it because I think it's something that's probably crossing somebody's mind as they're doing this. But I just want to, and I think I have a feel from the group, but can we just put out on the table the idea of staff secured or secured facilities? We do that with out-of-state runaways. If the interstate compact agreement allows for the, I'll call it the incarceration of an out-of-state runaway pending transport to the other state for management or release back to parents or guardians or however that child needs treatment. So can we just put that out on the table so that the position of the group is clear about where we think of that?
Is the question whether or not the group would be in favor of some kind of a staff secure or other kind of secure facility for these youth? Okay. Lynette, did you have?
I think the barrier to secure locked might be effective for the youth that already have bonds or in the criminal justice system. But the recent juvenile justice reform bills that were passed reduced the number of beds that are available across the state for detention. And kids can run away multiple times and the courts are not going to put them back into detention more times than not, unless they're committing other crimes. Because of that ACLU intervention, and it's across the whole nation, I don't think we're going to see that change. It's not that I disagree with you. There used to be an option for medium secure, and that was not counted in detention caps, and that might work again for juvenile delinquents, again, but regular child welfare kids with just significant mental health issues are not going to qualify. It's no longer legal to put a kid in a secure detention facility just because they need mental health treatment.
And as a parent, he says that's unfortunate. I just want my kid to be safe first, you know.
Yeah.
As hierarchy of needs. Safety first, then we'll work on the rest of the stuff little by little. So I feel as a parent exactly the opposite.
Oh, you're preaching to the choir, Kevin.
Norma?
So I think, there's a place for everything, right? So I would agree, Brian, that, on a small level, I think that would be really well. I think we would have to, as a system, do a very good job of making sure that we are putting the right child, that it is needed for that child to really be in a staff secure setting. And that can't be the first time the child runs, everyone's putting every kid in a staff secure setting, because not every child is going to need that. And so personally, although I agree with it, I don't think our system is ready or set up to be able to do that well, in my opinion. I think we will end up with every kid that runs being put in this staff secure place. And I don't see the benefit to that. Kevin, I understand what you're saying. I can't even imagine as a parent what that would feel like, right? To know that you don't know if your child is safe or not. But I just, I think we have a lot of work to do as a system before we're able to get there, in my opinion.
Thank you, Norma. Any other thoughts on the staff secure question?
Well, if it can't be done, it can't be done, but there might be some value in this group saying it should be done. I was holding that opinion. If we all agree on that, if we don't all agree, then that's a different system. As far as, it just seems to me that you'd want to be overly secure as opposed to under secure. And again, I go back to my Arizona experience, but I have 30 others. I mean, my kid ran away 45 times from everywhere. So.
I don't think you're all wrong, Kevin. I really don't. And maybe it's something that should be not necessarily in this group, but it could come out as a recommendation that the state should take a look at staff secure or medium secure for detention delinquent youth or something like that.
Lynn, I just, you're like muffled to me.
I'm so sorry.
Your mic is just really muffled. There's just a lot from you I can't make out. I can hear the words. It's just a muffled sound. So just so you know, that's been my experience today. But I don't know.
I was just going to say, I don't think that you're all wrong, Kevin. Yeah, it was hooked to the wrong microphone. I apologize. I don't think that it would be inappropriate for us to say that the state should look at creating staff secure or medium secure detention for these youth. I know that there's a lot of legislative barriers to it. And so I just didn't want to make it sound like it was an automatic, that it's something we can realistically accomplish.
Not enough. I was just trying to create a demand signal, if indeed that's the demand.
Yeah.
Yeah. I mean, I think, Kevin, I would agree. I think, again, there's a place for everything. And so on a small level and well utilized, I think some children could probably benefit from that, right? But I think it would just have to be regulated really well. And again, on a very small level, and there have to be some really clear protocols on how to use those beds. I guess the other question I'd have for you, Lori, is and I get that we're not able to do it now, right? But let's just say, whatever, 5 years from now, if we were able to do something like this, would they run like detention? So meaning children wouldn't get meds while they're in there and like all of that stuff, do you know? Or would that be something that would be run, by you guys or regulated by you guys? Does that question make sense?
Yep, it does. It does. So first of all, I just want to say to Kevin, right, like, I know, it is difficult being a parent. I parented 3 children myself, and now they're all adults. And, I myself was not the best child ever. And so, right, like we all come into this field some way, somehow, right? And mine was to provide hope, because there is hope. I don't mean to be condescending, but I need to really identify that these are children. They are human beings. And not to mention, we live in the United States of America, which is a free country, right? And in order to have your rights taken away, I'm not trying to be condescending, but in order to have your rights taken away, you have to commit a crime. Sergeant Carter and his staff cannot just go through the community and arrest people and lock them up if they have not committed a crime, right? And so these are children, and just like adults, they have rights, right? There's the Miranda rights, there's the rights, you're innocent until proven guilty. There's all kinds of things that we have in our Constitution, and that includes our children. And so, I just want to remind people, we are talking about children. And I understand, though, we're talking about the safety of children, which is incredibly important. And there are other methods out there besides locking up children, right? I mean, there are ways, and I talked about it a couple of times ago and presented some of the things that we are doing from a licensing and monitoring standpoint, right? Number one, we have created a team to move our providers into quality standards, not hovering around the minimum standards, to really implement these practices that I put in, implementing trauma-informed care, implementing having safety plans. If you know a child is going to run, why wait until they get into placement to develop a plan about when they're going to run? Which I will tell you, I was involved in the Timothy Montoya case. I can truly tell you and honestly say that there was no plan in place prior to him coming into placement, though it was very well known that he was runner. Okay, so safety plans, I can't remember who brought that up, I believe Michelle. I mean, that is, if you know ahead of time, then you can make plans ahead of time. Implementing trauma-informed care. There are de-escalation techniques. You can observe a child from a clinical perspective, right? Mental health, you can observe a child who is agitated, who is getting ready to run, and prevent them from running prior to them running, right? It's not going to stop every one of them. But these are not supposed to be just babysitters in the residential childcare facilities. They are supposed to be educated individuals on how to work with these kids. So the department has also taken upon, I'm actually working on a staff training academy to train all residential staff, a 40-hour core training, to include clinicians, supervisors, and staff, to provide them the tools necessary and the resources necessary to be able to wrap those services around these youth to prevent runs, right? I mean, we just talk about it as, well, we need to restrain or we need to lock them up, but we need to think outside that box, right? We need to really problem solve about what are their other options. There's tons and tons of research out there, I assure you, because I have staff that's all they do is research to try to figure out how do we combat this issue, because this is not a Colorado issue. This is a United States issue. I assure you that we have, I hear from other states all over the place, right, that are experiencing these same issues with our kids. I started as a social worker in 1987. I just aged myself. And right, like I've been a parent, I'm now a grandmother, though I'm a young grandmother. So I get to use that youth thing still, right? But at the same time, right, like I can tell you, kids in 2024 are so different than kids in 1987. The mental health crisis that even our pandemic has created, Sergeant Cotter, I know you know, because I've met with your staff, I know you understand, right? It is a huge crisis, a mental health crisis across, not just with our youth, but with our adults too. And how do we combat that? How do we get down to the personal, right? The human being of who we're speaking about, and really trying to figure out, like, hey, trying to get in their brains, what is going on? How is this happening, right? I mean, we have many gaps in services. The pandemic hurt, and then the implementation of Family First which I don't know if everybody really truly understands what that meant, but that was the federal government's way of overhauling every child welfare system across the United States of America. Once again, it is under a financial bill. I would encourage this group to go and read it, to look at what our providers, Norma, right, like what they've had to endure, what the department has had to endure, what the counties have had to endure. We have so many different things that have worked against us, so to speak. And then we have this crisis with mental health, with human beings. And so, you know, I really encourage this group to really work more in doing some additional research to really dive into, is it all about lockup? Is it all about restraint? Or are there other means that should be implemented and should be required of our providers, right? And then I'm just going to tap in one more time with Norma on the rates and not agree enough, right? Like the department has worked super hard, as well as the legislators, to try to increase those rates. Unfortunately, like the providers are going to get a 2% increase this year. It's not a lot, right? And they still are not competitive with the real world. But yet they're taking care of some of our most precious individuals, which are called children. And so, you know, with that being, right, like where are the priorities? Where are the priorities about divvying up that money? You know, I just read today that the legislators are divvying that money up. The Tabor and so forth are kind of divvying up that money to more impoverished families, which could, you know, have a domino effect, but it's still not enough, right? The resources and so forth are just not enough across the community. So just sorry on that rant, Doris, but
Yeah,
I just
no
think
worries.
it's important to get back to the basics of what human beings, and not to mention, I have not heard it discussed once, is about the EDI, the equality, the diversity, the inclusiveness. You know, many of our children that are arrested or, you know, that come into care are, you know, they, you know, there's a unfortunate discrimination that still occurs within our communities, right? We, even in Colorado, the statistics, which is so disheartening to me because I am proud to live in Colorado, right? Because I believe there's a lot of diversity here, but there's also still a lot of discrimination that occurs against our Black youth, against those with different ethnic backgrounds and so forth. Another issue that the department is trying to combat at this point, right? So I worry about if we're going to lock up kids and we're going to restrain kids, is it going to be a certain population that we engage with? And I really want that discussion to be part, or that topic to be part of this discussion as well, because we do not need to engage in any more discrimination that already occurs.
Thank you, Laura.
Sorry, I'll go.
No apologies needed. I think that the staff secure option, which doesn't have to include locked facilities. It could just be that you're using staffing levels to promote just greater eyes and attention to a youth that is at a higher risk. And so I do think that having that as part of our consideration for this temporary placement option is worth talking about and considering. Brian, Kevin, and Sergeant Cotter, will come back to you. We're going to take a 10-minute break. I'm really bad at breaks, and I know that 3 hours is a really long time for adults to sit in one place at a time. So my clock says 10:13 your time. We're going to come back at 10:23. We'll wrap up this conversation, and then we'll go back to the other group is going to join us. We'll wrap up this discussion, and then we'll be joined by the rest of the group and wrap up the task force meeting. So we'll come back to you, Brian, Kevin, and Brian when we get back. We'll give everyone just another 30 seconds or so to join back in. It looks like we lost some people. Am I right? Seems like we have more boxes. All right, we'll go to Brian, Kevin, and then Ryan, Sergeant Cotter.
Thanks. I'll be quick. I just wanted to give a brief reminder of where all we've been with the task force. I know that we've divided into these two subcommittees, prevention and intervention, so we haven't always been super well up to date on what's happening with the others. But I just wanted to say that the prevention subcommittee, one of the topics they've taken on is this question of physical infrastructure and hardware that could include, but doesn't always include, things like locks or staff secure facilities. And that they put together draft recommendations that were brought to the whole task force. So that's definitely a conversation we're already having. And so we'll it's great the connection that's being made to also include those considerations in thoughts about temporary placements. So I just wanted to let you know that we'll do our best to synthesize these overlapping concepts, which is, there's just overlaps happening and a lot of the things we've talked about over the past months and months. So I know it's hard to remember exactly where all we've been, but I just wanted to give that brief reminder. And then just, there's been an ecosystem of recommendations put forth by the task force that overlap, that touch on a lot of the questions that have been coming up today, like the post-run response and assessments and making sure that youth are in the most appropriate environment for them. So revisiting that, all of those sorts of policy considerations hold us to this. But in the final report that we come up with, we'll be able to interweave those in an agreeable way that the task force is able to be proud of. But we've done tons of work. I know we're continuing it. I just wanted to give recognition that we've already come a long way. So thank you all for that.
Awesome. Thank you, Brian. And I appreciate just the reminder of the intersectionality, if you will, of each of these recommendations that we're trying to flesh out, so that we can, try to keep that a little top of mind in the conversation. Thank you. Kevin and then Sergeant Cotter.
Just a comment, Lori, I agree with most of pretty much all of what you said. Just one quick comment that I agree kids have rights, but a lot of rights for youth are usurped by the parents. They, are and always have been. And therefore, if a parent places a child in a facility, that child should be expected to stay in that facility. And, I mean, that doesn't seem at all wrong to me. And, so we have to protect them from themselves. That's why you ground the kid. That's why you do anything. So I want to be a little bit careful with they have rights, because they don't have a right just to run away if they've been placed by competent authority or a legal guardian or a parent or the legal system in a facility.
Thank you, Kevin. And I think too, like, as we think about, and I said this right before we went on break, as we think about these temporary placement options for kids who run from care, really thinking about other ways that, a youth efforts can be made, to, keep an eye on the youth and keep them in that placement could include staffing levels such that you're using kind of a staff secure model, even if the facility is not locked. And just to, echo what Brian shared, in the prevention subcommittee, they are really looking at the physical mechanisms that could be used in a facility to keep the youth in that facility, which may include locks. And so marrying the two options, I think both as a, because temporary placements are interesting and unique in a way because they are both an intervention and a prevention. And as we've been talking about the intervention work, in each of the things that we've talked about, this group has really been thinking about using that, whatever that mechanism is, as both an intervention and a prevention effort for future runaway or to reduce or mitigate the risk of future runaway. So it's messy. There's not a clean distinction necessarily from topic to topic, and so really trying to keep us focused, but also just recognizing there's not a clean separation all the time. Sergeant Cotter.
Yeah, I first want to say that I agree with everything Lori said. I think these are kids, and we need to treat them as kids. We need to give them every chance to grow up, and realize that without exception, they are in a spot that they really didn't control. Like things, the world has come around them in a way that's caused them to respond in a way that it's not as exciting for the rest of us. And we need to help them come around to the safe mechanisms. With that said, Kevin's right a little bit too. Like we have to make sure that they're safe. I couldn't imagine being a parent with my kid on the run and not knowing what they're at, even for an hour, let alone hours. And as a guy who routinely talks to families where their children have been gone for even a half hour, and they're panicked, I fully understand where they're at. And these kids, unfortunately, in many cases, don't have those people and continue to try to advocate for themselves in dangerous ways. And so, and Doris, you really nailed it, how we've got this prevention and this intervention that are overlapping in this moment. This conversation is all about that overlap. Because in the moment when they're a runner, the law does allow us to use reasonable physical force to take that child into custody and bring that child to placement. Once they're in placement, standards start to change. And so I want to encourage this group to remember, we should not stare at the law as it exists right now. We should contemplate what is best and do we need to change. With that said, I'm not advocating for handcuffs on kids. Like that's not at all going to be the best outcome. But in that moment, again, that 1 a.m. moment, is it a good idea to put this kid in a family home where he can just walk out the back door? Maybe not. Maybe not. We should really be putting some thought around staff security. How do we get those really competent professionals with that kid at 1 a.m. when the kid is tired and they're tired, or maybe they're not even at work? How do we make that all come together to stop the run in that 1:30 in the morning moment? So I don't want us handcuffed by what we've always done. When we say we can't put kids in holding facilities, I don't want us to just say, well, that's that. I want us to challenge ourselves and say, well, what could we do to keep this child out? I say all that as a guy that doesn't have the answers. This is not my realm. I am not the professional who can manage kids. I am a parent, but I'm not a darn good one. I'm a parent like the rest of us, trying to figure it out every day. And so I really want us, especially those of you guys that do these things, to just put the rules of today aside and think hard about what really would serve our kids best. And that's not to advocate, again, for handcuffs or secure facilities. It's to advocate for a challenge in our thinking.
Thank you for that, Sergeant Cotter. And I think related to that point on, not allowing the current law to be a barrier is really thinking about like what the whole point of the task force is, to put forth recommendations that could be transformative and might actually butt up against, require law changes in order to execute on. So not limiting ourselves to the current recommendation related, or the current law. I think related to that is, and in our prep, we had some of this conversation, is that in many instances, and I've spent a lot of time in child welfare, we limit ourselves to Title IV requirements, and there might be opportunities to braid funding from other sources, including federal sources, to support some of the efforts that might be in the best interest of the kids as it relates to this particular issue. And so I think not only not limiting ourselves to what Colorado statute says, but also not limiting ourselves to our existing funding mechanisms and the requirements on those, if there is an opportunity to draw down additional funding sources to support the needs of these kids in the right way possible. The last thing that I want to say, and would invite some additional conversation for consideration, is I want to bring back Lori's final comment around considering issues around equitable interventions. And as we think about, and I know that at least in this group, we haven't really talked a lot about ensuring that there are equitable approaches to youth who run away, both in like the assessment. I think that there might be an opportunity to add some language around ensuring that it's culturally competent, or embeds cultural humility, and is demonstrated to have some equitable impact, but also looking at, you know, which kids get returned to a more permanent placement once they're found, and which kids sort of get routed to this temporary stopgap placement, ensuring that there is equity in that kind of a decision as well. And so I just want to name that as a kind of explicit way of making sure that equity comes into this particular conversation around temporary placements. I just would invite any other thoughts or considerations as we think about ensuring an equitable approach to temporary placement for youth who have run away from care.
I'm just going to say I agree. I think, first of all, we have to remember what we're talking about is temporary. We're not talking about long-term staff secure, long-term locked facilities, long-term anything. We're talking about a short-term intervention that can provide stabilization, get to the heart, try to attempt to get to the heart of what's behind the runs, and really meet that kid where they're at, so that we can get them in the right placement for the right services at the right time. In the meantime, we have to figure out the 1 o'clock thing. And I don't know about the rest of you. I don't like getting up at 1 a.m., but I've done it.
I like it less the older I get.
No kidding. There is a way forward. There's a way where we can keep kids safe. We can continue to give them their rights as much as possible, because that is a civil right issue. And yet they are children, and the court has jurisdiction over them, and the court can institute orders. There is a way through this. There's a way to figure it out. And I think we're on the right track. That's my personal opinion.
Thank you, Lynette. Other ideas, thoughts, reflections? Want to make sure we get on the record for this conversation. For those of you who have implemented the ad hoc kinds of interventions as a temporary placement for young people who have run away, are there additional considerations, lessons learned, things that we should think about memorializing in a recommendation around temporary placement?
24-hour placements rarely work. You're doing more harm to kids than you're doing good. Using this ad hoc, you take them today, you take them tomorrow, I'll babysit today, you babysit tomorrow, just leaves kids in even more limbo and more certain than ever before that we cannot meet what they need. So why stick around?
And, you know, from our last conversation, we talked about 21 days. You know, even if you may not need that length of time, but it sounds like the stopgap of, you know, cobbling together multiple places that are willing to take the youth for a very short term is certainly not in the best interest of young people. Norma, and then Beth. Norma, you're muted.
Well, now I forgot what I was going to say. No, I'm just kidding. And so, so I was going to say that, I don't know how to word this or if it even belongs in here, but a way to sort of talk about, like being purposeful about how we come about, you know, making, you know, kind of creating these places for kids to go to, right? The need for there to be, you know, I don't know, specialty areas or something, I think is super, super important, so that when we do put a child into one of these, you know, temporary beds, assessment beds, whatever we want to call them, 21-day beds, 14 days or whatever, that we're not just doing it flippantly because they have a bed open, but that instead we're doing it, you know, purposefully and intentionally. I think that part is really, really important because, you know, I think Beth said this, or somebody said, you know, the beds are going to get filled really quickly. I believe that. But if they're filled with the right child for that milieu, for that environment, then we will be able to really stay true to that 21-day, you know, 14-day sort of, you know, door out, if that makes sense, right? So then those beds can continue to be open for the right kinds of kids. And if we have enough of those, I think we will be okay.
Thank you. Yeah, I mean, one of the things we haven't really talked about or like with any like concreteness around, you know, what are some of the youth characteristics that might make for a specific kind of placement. You know, in this conversation we haven't talked a lot, but I would imagine that trafficked youth would have to have, you know, kind of a specific type of placement. But put the question out there, like, are there other youth characteristics that would make for, you know, sort of like identifying that as a characteristic for a specific type of placement? Does that question make sense? And so if there are other characteristics that come to mind, I think we want to make sure that we're naming those things.
I think substance abuse comes to mind right off the top.
Thank you.
And being a victim of sexual abuse is a common.
And then, thank you, Lynette. And I think from earlier conversation today, as a disqualifying characteristic that we want to include is youth who have a lower IQ, and maybe even youth who have some identified diagnosed mental health needs. Beth?
I guess to answer your question too, like, I know that there's talking with, you know, different courts, like drug court, and not wanting to like write youth that have substance use mixing necessarily, or like another aspect of that would be like gang issues. And I think that too goes hand in hand with like the initial assessment and that information being shared with the facility that they're going to, so that you're building out a place. Because we also don't want to create things where it's like, okay, now we're creating that list that restricts them from getting access. But having that knowledge of like, okay, if we have an individual that maybe, you know, maybe different gangs or that kind of an issue, so that we're not entering a problem, but we're not also then being like, oh, we can't just simply accept that youth. So like creating, ensuring that there's still a place for everyone to be placed. And then what I originally raised my hand for was like going back to like having that youth voice and the transparency with them. So what do they want? And I realize sometimes that's always not going to be able to line up with where the placement is, but at least having that voice being heard and then explaining the why. And I think Lynette brought this up of like really youth we've had with our cases where it's just like, I just want to know what's going to happen next. And it's really frustrating when we just can't provide that. And so I think being really intentional of like this is what this placement will look like, and here's that time frame, and here's what's going to happen next, not just this constant limbo for the youth.
Thank you.
It's also really hard to, when you're sitting with the youth and you've made 20 referrals, right? And you're just getting denials, to sit here and tell this youth who's already traumatized, who already feels like they're not wanted, to be like, they don't want you either, right?
Mm-hmm.
That is hard. And it just further perpetuates the running and the behaviors, right? Like that is the part of the job that I hate, is telling the youth they don't want you because of these behaviors that you have because of this trauma, right? Like that is just so hard.
Thank you, Michelle. All right, we have 2 minutes before we're gonna be rejoined by the other group. So one last question for all of you, because we haven't talked about this explicitly. So, but as we think about recommendations, one of the things that we have talked about was sort of like this framework, that in my mind includes like some articulation of statewide recommendations for what this framework looks like versus having a county by county kind of ad hoc, we figure it out on the fly kind of system. I just want to get explicit as to whether we are all thinking about kind of this statewide framework and approach to building out a continuum, but the continuum that includes a temporary placement option for young people who run away that can be accessed regardless of where you are in the state. Are we all thinking about this recommendation in that same way? And if not, would love to hear from those of you who disagree, so that we can get that on the record, what your specific concerns are, or what you would recommend instead. So we're all on the same page? All right, Brian K, did that answer your question? Okay, perfect. Yeah, I agree, Lynette. And I think, we've talked a lot about staffing and funding, right? Like those cannot be solved at the county level, I think, particularly in those counties that are less well-resourced. And so a statewide approach really would be critical. And I think bringing in some of what Lori shared about, kind of the licensing piece, and she has also reaffirmed or reiterated the concerns around reimbursement rates and things like that. So that statewide approach seems like it would be necessary in order to close this particular gap. Awesome. All right, I guess we're just waiting for the other folks. We're right at 12:45. We did a lot. Thank you all for what I think was a really rich discussion. I know that we started like touching on some of the tentacles that relate to, things that we've talked about before, and also some of the work in the other subcommittee. But I think it really is important for us to be thinking holistically and just recognizing that, again, it's hard to like really narrowly focus on the one thing when we all really are thinking about and concerned about the broader ecosystem in response to kids who run away from care and how to best meet their needs. That's all I got. So now we're just going to look at each other until we start hearing some pings of other people coming back into the room.
Thank you for leading us, though, Dora. You did a great job. I appreciate it.
Awesome. I appreciate it. Thank you. Thank you. I love how folks have what appears to be started checking emails. Like, listen, nobody had time to just be sitting here doing nothing. I'm going to multitask. I think reading your mouth, Lori, I think you said always.
It's true, Doris. It's like when you're back-to-back meetings, it's hard, right? It's hard to keep up with the demands throughout the day. So yes. And it's getting harder and harder the older I get, right? Like I used to say I'm a great multitasker. I am not. My staff.
Oh my gosh. Same. And it's like, and also just like keeping mental to-do lists. It's like, I don't need to write that down. No, girl, you need to write that down.
Yeah, that's so true.
Yeah, I need to combine my to-do list. I got one on the computer, one in my book, another one on my phone. Yeah.
Yeah, I do this. I do the same thing because I didn't need it. You don't need it until you need it. And then it's like, I don't have a good system for managing all these things.
All right, welcome back, everybody. Thanks so much. I know a lot of great discussion in our group, sure as well, and on the intervention side. I want to just invite if there are any members of the public on the phone that are on the call that want to provide public comment. I have not seen a note yet, but I just want to name that real quick in the main group. Please drop me a note or come off mute. Okay, seeing no public comment. Again, our job from here is to go back to the drawing board on these directives and make some sense of all the really rich discussions that have been had. And I know that we'll be coming back full group next month with some drafted language for you all to respond to, and potentially prior to that meeting, hopefully something to respond to as well. So just want to encourage us that, again, a lot of our work is via survey, responding, so that we can really have a pulse on the group ahead of these discussions, so we don't spend too much time in that in-between space. So just keep an eye on your email, and TBD. I haven't, of course, talked to the group yet on kind of where we land and how we're going to circle back, but we will, and we'll come back full group before breaking again back into our breakout groups for our final topics. With that said, Stephanie, want to hand it over to you for any closing comments if you have anything to add. Otherwise,
Nothing to add. Thank you all.
Okay.
Very rich conversation. I appreciate you all.
Yep. Thanks so much, everyone. Take care. And we'll see you at the next meeting.
Thank you. Have a
Thank
great
you.
week.
someone stop the recording? I'm not host, so.